This is also much longer than I thought, but I'm doing it the first time. We talked about this. Okay. So yeah. So this was already several months after the fall, but it can still be normal because when you have a bruise on a bone, the bruise is often between this sheet of very tough connective tissue that is kind of around the bone. And the bruising is then between the actual bone and that connective tissue. That connective tissue has a lot of nerves, and it really doesn't like the stretching from the bruise that's underneath. So that often hurts for months. So all of this is not particularly surprising. All of these things here are specific tests. They are usually used for checking on sciatic pain. And then there's the SI joint, the sacroiliac joint testing, and specific reflexes. So all of those things are normal. So again, good news and kind of frustrating results. So then we get into a little bit more practical reports. So now they're talking about osteoarthritis instead of arthrosis. The terms are often used either way. Usually, arthritis should be used when it's a recent inflammation, an active inflammation, and arthrosis when it's kind of old and more degenerative issues. Sometimes when you have chronic inflammation that isn't a new problem. Usually, arthritis is what people are talking about in the long run, colloquially, and only the sticklers for the terminology talk about arthrosis. This is the bursitis that we talked about, that is usually in the front of the hip, that might show up as like a bit of pain in the groin. This is like this thigh bone issue that they said they probably want a CT for. Here they did an X-ray of the back more higher than the low back, where they didn't really find anything. This is just this little bit of um, scoliosis. Here is a bit of inflammation of the joints on the sides of the lumbar spine, which is odd because it wasn't mentioned before. That's maybe why you put a question mark on there. I would think that somebody talked about it at some point. They say throughout, so I would hope that it is very mild. It comes up very often, um, but it is something that you're right to ask about. So that would be what is showing up as facet syndrome. I would really ask about it because mild, moderate, I would like to know a little bit more about it. It's good that there's nothing um, impinging on nerves, so that would be important in that regard. A lot of people have facet issues, but really, I would hope it's mild because that could cause a problem. So yeah, I later saw that, you had the physical therapy prescription. There was nothing in there for a specific pelvic floor therapy. Maybe they gave you that eventually. I'm not sure whether that would be really necessary. overall, the whole plan looks to me like they give you this pain management recommendation, which usually means we don't really know what to do with you. I have the concern that you had the low back pain for so long. I would love to talk to you a little bit more because these chronic low back pain issues, the longer it persists, the longer it's likely to persist. So I would be happy if you say that it has been changing over the years because the brain processes pain just like any other habit. And it becomes really more a habit of the nervous system than having a relationship to what's going on in the tissues or the bones or the joints.